Hi everyone, thank you so much for joining us for On Call for All Kids. This is our weekly segment here at Johns Hopkins All Children's Hospital, where we're speaking with our experts about different topics in pediatric healthcare. Today we're talking about all things sleep related. So here are your top 3 takeaways. Learn how much sleep your child should be getting and why that is important. When to be concerned if your child snores or naps a lot, and how screen time affects sleep. I'm Ashley Roberts, and I'm joined by Dr. Luis Ortiz. He is a physician here in our sleep center at Johns Hopkins All Children's Hospital. And Dr. Ortiz, it's great to have you here.
Thanks for talking with me.
Of course. So how much sleep should our children be getting every single night?
So most adults, most parents, they know that they need to get about 8 hours a night to be healthy. But is that true for children? Not really. So as we know, infants, they're practically asleep most of the day, awakening every now and then for feedings, but for the most part, they're asleep. Infants are going to be about that until they're toddlers, and toddlers are going to be asleep for a little bit over 12 hours a day. As you get into the preschool age groups, it's going to be a little bit less than 12 hours. School age kids, going from ages 4 through 12, we're going to be aiming around 9 to 11 hours, averaging 10 hours a day. Once we get into the teenagehood, we're looking averaging 9 hours of sleep a night. And that's one area where parents forget about this. Teens can look like adults, but their sleep requirements are still higher than typically normal adult. And that doesn't change until their late teens or early 20s.
So as a parent, we just have to know that our kids really need that sleep. They need a whole lot more sleep than we do.
A whole lot more sleep than they even realize.
Yeah. What are the side effects if they're not getting enough sleep? Because this can really affect them, during the daytime.
In a whole bunch of different ways. So there have been multiple studies that looked at how sleep restriction in children can affect health. So the first thing that we see a lot is effects in metabolism. So children's metabolism slow, so we see increase in obesity, increased risk for insulin resistance, which is a cause for diabetes. We also can see intellectual dysfunction, so their ability to understand and process things decrease. That can translate later on into decreased graduation rates in high school and even decreased rates of entering college. Finally, and also in the teenage group, that we also see increased risk for car accidents, which when you're dealing with a teenager that wants to drive a car, it's something you need to consider.
Oh, absolutely. So what are your tips and advice for parents of teens? What is a good bedtime for them to get the sleep that they need? Yeah,
so teens, if they haven't done it by now, they're going to want to negotiate their bedtimes. You're going to have to be smart about this and also respect their own wishes. It's a hard line to balance, but realize first, they're going to need 9 hours of sleep. Second, realize that teens, their circadian rhythms, their internal clocks are going to be naturally shifted to a later time of the day. They're going to naturally want to fall asleep later than than everyone else in the household, and they're going to want to sleep in later. Of course, that really doesn't matter if they have to get up on time for school. So I normally like to say aim for 9 hours. Don't expect too early of a bedtime because it may be impossible for them to do. And then finally, make sure that if they need help in achieving these goals, such as they might need help removing electronics or distractions around bedtime, then you lay that on the table for them to realize that it's helping them, and this isn't going to be a surprise when it happens.
Well, really good point to bring up electronics, all of those screens that we're used to being on, especially for teens and kids. How does that affect them right before they're going to sleep at night?
So all electronics with screens, so TVs, cell phones, tablets, handheld video game systems. The screens emit a wavelength of light in the blue color spectrum. That kind of shifts your circadian rhythm to a later time. You're not going to feel sleepier until later. You're essentially giving yourself jet lag when you expose yourself to this light at a later in the evening. So you can be laying in bed at 10 o'clock at night, but your body is feeling as if it's only 3 o'clock in the afternoon. It's going to be really difficult to fall asleep in that situation.
So what do you recommend? How far before bedtime should we put
I
away?
always recommend that parents and for themselves and for their children to put away the electronics 1 hour before bedtime. That allows the natural circadian process to reestablish itself and makes it easier to fall asleep.
Let's talk about snoring.
Snoring.
We probably all know someone in our household that snores.
Yeah.
Should we be worried if our child is snoring?
Yes. I typically worry when when a parent tells me their child snores. So about 10 to 15% of children will snore. The research is still out as to how much snoring affects a child's development. There definitely have been studies that shown that children don't succeed as well academically when they snore compared to children who don't snore. But the bigger risk is having obstructive sleep apnea. Less common than snoring, but obstructive sleep apnea has similar issues to not getting enough sleep. We see issues with metabolism, and issues with cognitive functioning, issues with mood, as well as other medical problems such as heart disease, such as hypertension. And then later on, if this couldn't go on for many years, and I'm talking about until adulthood, we can see issues with increased heart attack risk, increased stroke risk, and also increased risk for other disorders like depression and anxiety.
So your recommendation, maybe get to your pediatrician,
Yeah.
maybe get a referral
Exactly.
to a sleep expert.
Especially if your child is already having some issues with mood issues, concentration issues, or other medical problems such as hypertension, and they snore. That would be a good indication for a sleep study.
Okay, and Dr. Ortiz, just a few quick tips as we're about to head into the school year. I know a lot of kids are staying up later. What's your recommendation to kind of get back into the swing? We need to get to sleep earlier now.
So, the first step is you need to figure out what time they need to go to sleep. I always say, count backwards. What time do they have to get to school? How long does it take for them to get ready? And then what's the appropriate amount of sleep that your child needs? Then you'd want to give about half an hour wiggle room for them to fall asleep. So that's going to be the time that they're going to actually be in bed. Before bed, you want to establish a very clear and simple bedtime routine: brushing your teeth, taking a bath, reading a story, and then kiss goodnight. Keeping it simple and not too complicated helps the child relax and calm down and be ready for sleep.
Okay, Dr. Ortiz, thank you very much for joining us today and talking about all things sleep. If you have any topics you want us to cover or look into to interview our experts, you can comment below on this video. You can also check out our website. It's hopkinsallchildrens.org/newsroom, and we have a lot of different patient stories and great information there as well. Thanks for watching. We'll see you next week.